The mental health condition that we are explaining with the DSM-5 today is attention deficit hyperactivity disorder, ADD or ADHD, which appear to be lumped together under the diagnostic criteria. DSM-5-TR is the most recent updated materials and changes to the DSM-5, and included that in this TR is some information on the ADD and ADHD, which again appear to be lumped into one, attention deficit hyperactivity disorder. There's a YouTube video that helps to explain in kind of more simple terms, where ADD and ADHD basically are the same, and it kind of clarified some things for me, so I wanted to include that video. Under the diagnostic criteria, there are two main headings that are used, and that is the inattentiveness, and then secondly is the hyperactive or impulsiveness. The DSM-5 gives detailed, criteria under the diagnostic of inattentive, and it's inclusive of forgetfulness, not being able to stay focused on a long-term task, can't follow through with instructions, loses things, avoids and dislikes anything that requires a long sustained attention span. Hyperactive and impulsive area includes, super action, motor driven, can't seem to sit still, interrupting people, shouting out answers, blurting out them before the question's even finished, interrupting. And now all of these things, we must be sure that they're not like an action to an oppositional behavior or hostility or just failure to understand like instructions, because frustration can come from lack of understanding too. So we want to make sure that there are not other things that are in place that are bringing about the impulsivity, but that this is just their reaction to any one of these stimuli. Dr. Sipes' video on the diagnosis of ADHD with the DSM-5-TR, that's the additional material that was added even since 2013, was very helpful to me in understanding, some of the very, very details of diagnosing. She said it helps to be able to have little things to help us remember, because as we see, the DSM-5 is very detailed. And she calls this the 1266, where in order to diagnose under this, first of all, the behaviors have to be happening before the age of 12. And 6 to 9 symptoms have to be showing up for at least 6 to 9 months before you can consider this a true possibility for a diagnosis for a child. After the age of 12, there's the possibility that other diagnoses may be playing a part. So it's important that the symptoms have to have been before the age of 12. Therefore, adults can be diagnosed using a retrospective analysis, where they can, it can be shown that the symptoms were present before the age of 12. When we're identifying the criteria under the DSM-5, we have to keep in mind that it must be correct to the developmental level of the child that we are assessing for this. And what we're looking at is these criteria are there and interrupting the normal progression of the child's social interactions, as well as any educational levels that we're trying to help them achieve. The DSM-5 directions, we should specify whether we are diagnosing with a mild, moderate, or severe case. This helps us to move forward with a more appropriate treatment plan depending on the current severity of the disorder. A couple things to remember is that there is culture-related diagnosis when it comes to ADD and ADHD also. And the DSM-5 does suggest that culturally appropriate practice are relevant in assessing this disorder. Also, we have to take a look at the differential diagnosis and be sure that we are examining other issues within the client's behaviors and history to make sure that there isn't a comorbidity here of disorders, which is very common.